Welcome Rotarian Karl Braun, who is joining us remotely from the Rotary Club of Matthews. Hi Karl, how are you? I'm so glad you could be with us.
Well, thanks for having me on, Pat. It's good to be here and good to be with you.
Yes, and I want to say congratulations on a terrific. Karl is the immediate past president of the club, and you had really given everything. You had a wonderful year, accomplished a lot, and we're going to talk about one of those projects. So just very quickly for our audience, give a little background about Karl and your journey to Rotary.
Sure, Pat, thank you. It's been truly a career based upon healthcare. I've had the opportunity to be with a number of companies through acquisitions within the medical device, capital equipment, implantables, but also pharmaceutical industry. I've always appreciated the opportunity to be engaged in healthcare in order to help others around rare diseases, ophthalmology,
Sure.
MS, also rare blood diseases, but most importantly and recently glaucoma, which really has led us to the baseline of what created the district grant project that we put together. So, and running North America for Pfizer Corporation, I had the opportunity in their specialty division to work with churches and others in regards to bringing tests and opportunity to help bring better health to those in the community.
Well, that is a wonderful background and really leads us in. Why don't you give the audience a small snippet of the project and then we can kind of break it down.
Love to, Pat. It's been a fun project, as I mentioned, based upon what we worked with in the glaucoma screening. And it's about healthcare, bringing it to a local level to those who need it, educating and finding an opportunity to offer prevention before things get too serious. Here in Matthews County, we have about 10% of our population is eligible for Medicaid. Oftentimes, though, they try to get in and they're working and they make a little bit of money and they don't longer qualify. What we found is it's important that we offer health screening to those who need the help, whether financially able to pay or not. So the key indicators that we looked for were first A1C for basically diabetes and cardiovascular disease with BMI and also blood pressure. So we wanted to focus on those for the entire community of Matthews County and offer a health screening so we could get those people that might be prone to it, get them treated early and get the treatment they needed through the healthcare professionals of Gloucester Matthews Care Clinic.
That's wonderful, Karl. Now you have done that with both Rotary partner and with community partners. Speak about those two groups.
Sure. We were able to partner with our sister Rotary Club in Gloucester. Gloucester took their district grant in working with the Gloucester Matthews Care Clinic as well, identified a need that they had in being able to have a portable A1C testing equipment.
Oh, wow, yeah.
They utilized their testing equipment to purchase, they used their grant to purchase the equipment that we were able to use in the screenings. It's portable, it provides an input easily, and the output comes out 10 minutes later. So we're able to quickly identify if there is a diabetes situation. And it doesn't just measure at that moment, it measures over a 3-month period of time, which gives us a very accurate reading. So working very closely with the Gloucester Club in supplying the equipment with their grant, identifying the needs with Gloucester Matthews Care Clinic, and then us putting together the screening to utilize the equipment. Really, all three of us worked in concert in serving the people in our community.
And that really is not only a cooperative partnership, but a wonderful example of a collaborative partnership where you're really bringing needed elements to a single project as equal partners, really. And then how did you go out in the community with this?
Great question. We worked very closely with the Gloucester Matthews Care Clinic in identifying the proper population that they felt was really in need based upon their years of service to the community. We first went and worked and coordinated with churches in the area. We identified churches geographically around the Matthews County and found that many of them were open to helping their congregations and friends of the congregation come to the health screening. So we set up our first screening, Pat, and had announcements go out via Facebook, through our direct mail campaign, but also through the church and church elders. We set it up on a Thursday afternoon and evening, and we were ready to go with a staff of 8 people there, both healthcare professionals, doctors, and as well as Rotarians. Unfortunately, we were the only ones that came to that health screening.
Oh, wow.
So I think one of the things that we quickly learned is being a little more adaptive in regards to what we're going to do next time.
Yeah, and that's, I think, a wonderful example of lessons learned, and the fact that you were open to adapting the program. And again, I think that's an example of the collaboration, because everybody learned, everybody knew what you had to redo. What are some of the highlights for you and the club in terms of A, having done this program in the community, and then B, how it helped the people in the club, the kind of joy that it brings you?
Boy, that's a great question. I think one of the things that we found is we really wanted to help serve the community. So we came back and met with others in the community as Rotarians went out and asked other churches, as well as other civic groups, where people of need might be. And I think what happened was we found a great spirit out there that others had done similar programs and felt that weekends, which we originally had targeted, but also public options where there's a number of people around that would be walking by and be able to identify that the test was only 15, 20 minutes. But what really brought us, as you say, the warmth and gratification of serving the community was 2 patients in particular that were helped to, were guided by fellow Rotarians to the health clinic, because these Rotarians were aware that they had health need, but couldn't take the time, nor did they have the transportation to get to the screening. We were able to do the screenings for both diabetes and cardiovascular, and we were excited to find out that they were in good health. But with COVID, as well as the challenges sometimes of some of our fellow citizens out there not being able to go into town, public transportation not only available for them, being able to drive them there, and also have this health check be there for them. I think everybody felt that success, and then others by holding it at a more of a community setting on the weekend, that we found the solution by working together with civic groups, churches, as well as going out and just sometimes asking the simple question, where do you think these people are and how can we best serve them? And then having the success of being able to screen people and bring them there and find out their health is okay, but having them know there is a place they can go to get the help they need in the future, if need be.
That's, you described such a wonderful, multi-layered exploration, if you will. First of all, you learned a lot about your community, a lot more than you knew when you started the project. And that will be certainly helpful in other projects that you do with the community. Sometimes we overlook the issue of many people do not have transportation readily available to them. And so how do we provide for that? And being able to work as a community of Rotary clubs, that's got to be a highlight. That brings the brand of people in action to the fore and showing people in your community.
And Pat, you bring up a really great point that we learned is local knowledge and local customs. What we found out is that oftentimes that people are uncomfortable being in a clinic setting, not knowing how long it's going to be. Is this a half hour? Is it going to be exposed to other? Will my healthcare be seen there? Do I really want to be affiliated with certain groups and getting my healthcare exposed? So we've learned a lot in trying to make it an open affair. It was educationally based now as opposed to just a screening. And that also brought people in. That a healthy snack seems to help as well. But understanding a local community and its needs, asking those questions, not letting the first screening slow us down, but continue to evolve. So we're very excited. At our last screening, we had over 15 people attend, which we felt was a great success for a community of our size.
Well, thank you very much, Karl. This is going to be wonderful for the other clubs. As you know, we're putting a repository of our club's significant projects together.